Thank you so much for your time and attention this evening and for naming Turner House a finalist. We're delighted and thrilled to be here, and we're very appreciative of the impact of your giving in the Kansas City community. So I'd like to share a little bit about Turner House and speak to you about our specific request. We're asking for $18,856 to replace the laptops that our medical and clinical team uses every day as we're treating our patients. Turner House is located in the heart of a community of great need in Kansas City, Kansas, where 40% of the children live in poverty in the county. In the neighborhoods that we serve, that percentage is much higher, and I'll share some statistics with you in a minute. But our mission is to provide access to quality health care for underserved children. And the project value to us supports our strategic objectives with our mission and our organization. And those are to increase access to quality health care, to improve health and healthcare quality for our children, and to reduce health system costs. And we use technology to support our ability to deliver these things. So this is a very strategic need for us and a very strategic project. I couldn't bring our patients with me this evening, so I tried to share some pictures, and one of the joys of the work that we do is we get to see these beautiful children on a day-to-day basis. So we do serve about 5,000 patients in our active patient files, and this year we'll have about 11,500 patient visits. We have had 37% growth in our patients and our visits over the last 2 years. There is no shortage of demand for our services. So even as the economy continues to improve, the low-income families in our communities are continuing to struggle, and they have very limited access to health care. We serve an at-risk population. We only serve children newborn to 18 years of age, so we're a nonprofit pediatric clinic, and 88% of our patients are living not in a range above or below the federal poverty level, but at the federal poverty level or below. And of our children, about 80% of them are on Medicaid, and what that means for our patient families is that the families don't have to wait to have that extra pocket money to pay a nominal fee to come see us. They have access to services. What you also need to know when I talk about Medicaid is that Medicaid only reimburses about 50% of the cost of a patient visit for us. So we have to raise the rest of the funds that we need to run our organization. About 88% of our families are Hispanic, and many of them are speaking Spanish in their homes. We also have a growing number of children who are Burmese and Somali. So we work a lot with interpreters so that we're providing culturally competent and sensitive care in our clinic. We're, again, located in the heart of this working class, low-income neighborhood in Kansas City, Kansas, which is where we've been located for 24 years. Our practice is bilingual. Most of our staff speaks English and Spanish. And we do have extended access, so we're open evenings and Saturdays as well as 5 days a week. And we do practice in care teams. And this is a really neat concept, and I'll tell you a little bit more about it in just a minute. And we have 22 employees. We are a patient-centered medical home, and that's our practice model. We're nationally recognized by NCQA, so that's an accreditation that we've achieved at the highest possible level. And that's a huge change for us. We were recognized in 2012 when we went from a volunteer staffing model to having paid staff and practicing with this model of care. And electronic medical records and the laptops that we're asking you to provide are a core and central piece of what we're able to accomplish as a patient-centered medical home. Our current laptops are at the end of their warranty. One of our providers is using a laptop that literally is falling apart. And we have to have specific laptops to be able to utilize the software that we use for our practice management system. So what we're using our electronic medical records to do is we're tracking data and we're tracking information that's recorded in the patient files. And that is allowing us to achieve improved health outcomes for our patients. So we're really practicing this future model that you hear people talk about. And here we are with these low-income families in the heart of this low-income neighborhood practicing state-of-the-art pediatric medicine, which is just so darn cool. We can't, sometimes we pinch ourselves because we can't believe it. So what we're doing then as a patient-centered medical home is we are taking responsibility to manage the health outcomes of our children. We've identified some of the most frequently occurring chronic conditions that happen with our patient families. And one of those chronic conditions is these children need to have developmental physicals and immunizations. So we're using our data to make sure that they're coming in for their regularly scheduled appointments. Asthma, obesity, dental caries, 42% of the kids we see have active cavities. So we are in the process of adding dental services in our practice, and we need the laptops to be able to capture the information about patient needs to make sure we're reducing that percent. And then I've mentioned that we're integrating care with dental services. We're also bringing a bilingual behavioral health consultant on site. And again, it's the backbone of the data we're able to collect and exchange. And if we don't have laptops that work, we can't make this model work. So, a few things about the project value to our families. Because we've been able to adopt this practice model, then our patient families have better access to their doctors, and the doctors have better information to integrated care. When a child sees a specialist, we have access to those records. When a child's been diagnosed with a chronic condition, through the electronic medical record, that information is at our fingertips. And with our low-income population, it used to be fragmented across the city. So it's really great that we have access to that information. We've been able to reduce our waiting time for appointments because we're actively managing our scheduling system through the electronic medical records. And again, through the access and communication that our care team has using their laptops, the front desk is able to notify a doctor that they've got to respond to an urgent need. So it really, really helps. So the quality of our care has increased, and as a result, we're efficient and we're reducing costs. I wanted just to share a picture of the top, this is what we used to work with, our paper charts. And at the bottom, Maria, our certified medical assistant, has one of the laptops that she takes with her into the room to record patient data. Our doctors also are taking laptops with them when they're going into exam rooms. So it's a very key component of what we're doing. And I talk about data and the importance of it and how we're using it. So I just wanted to share with you, here's an example of the difference that we're making. In Wyandotte County, Kansas State, and Turner House patients, this is the immunization compliance rate for our 2-year-old patients. So we know what we're doing is working, and we need your help to make sure that it continues. If you have a moment and you're interested when you go home, go to YouTube and type in Turner House Children's Clinic, and you can take a look at our clinic and learn a little more about us. So we thank you for your impact. And any questions?
I just want to say I'm really, really happy to see your immunization rates. That's really, really impressive.
And I have asked you to repeat that.
I love your immunization rates. Awesome.
Thank you.
Thank you. One right here.
Sorry, you mentioned your laptops were near the end of their warranty. How old are they?
They're 3 years old.
And
They
then-
launched our electronic medical record system in 2012.
And then in terms of your ask, would it cover both that software component as well as the laptops, or just the laptops?
It's just the laptops. The software costs us about around $30,000 a year.
What software are you running?
We're using eClinicalWorks, which is an electronic medical record system that's designed for community health.
Thank you.